Point number 1, hypoxic hypoxia. When oxygen is not enough in the atmosphere, then PO2 will be less, like high altitude. So these all types of hypoxia are called as hypoxic hypoxia. And whenever there is hypoxia, now tell me, when there is hypoxia, these are going to stimulate peripheral chemoreceptor or these are going to stimulate central chemoreceptor? Only peripheral chemoreceptor. Why? Central are only sensitive to hypercapnia. On the other hand, to hypercapnia, both are sensitive, peripheral as well as central. So who is the most potent stimulus? Hypercapnia, because this will stimulate both peripheral and central. So now in hypoxic hypoxia, when there is decreased PO2, it will activate peripheral chemoreceptor, it will increase respiratory rate, and management is oxygen supplementation. Number 2, anemic hypoxia. Suppose there is enough oxygen in the atmosphere. Who is going to transport this oxygen? Hemoglobin. To every cell of your body, hemoglobin. So if oxygen is enough in the environment, but hemoglobin is not enough, anemia is there, it is called as anemic hypoxia. Number 2, when there is carbon monoxide poisoning, it also behaves like anemic hypoxia. Why so? See, oxygen and hemoglobin are best couple in the world until hemoglobin has seen beautiful carbon monoxide. Hemoglobin has 210 times more love for carbon monoxide. So when he gets carbon monoxide, he forget to carry oxygen. So because hemoglobin has more affinity for carbon monoxide, it will not transport oxygen. So either hemoglobin is less or hemoglobin is there but busy with someone else like carbon monoxide. In both conditions, it is called as anemic hypoxia, and peripheral chemoreceptors are not activated because they respond to only less in PO2 in the plasma, not hemoglobin. So in the plasma, PO2 is okay, problem is with the hemoglobin. So oxygen transport in the plasma is perfectly okay. But you know the maximum oxygen transport is by hemoglobin. So that is not working properly. So peripheral chemoreceptors will not be stimulated. Number 3, stagnant hypoxia. Now you have enough oxygen in the atmosphere. Your hemoglobin is there, he is not busy with someone. Even now you can have hypoxia. Why? Because heart is not pumping. RBCs are immotile. RBCs cannot go to the tissues until you pump with the heart. And when heart is not pumping, it is called as stagnant hypoxia because there is decreased cardiac output. It is called as ischemic hypoxia. Arteriovenous oxygen difference will increase because lot of oxygen will be on the arterial side, but is less oxygen on the venous side. So this difference will be very, very high. Sometimes they will ask you in your examination, it was one of the MBBS MCQ, that arterio oxygen hemoglobin difference is maximum in, answer is stagnant hypoxia. Cyanosis can be seen in stagnant hypoxia. Now histotoxic hypoxia. Oxygen is in the atmosphere, hemoglobin is there, heart is also pumping, but tissues are not willing to take because of cyanide poisoning. Cyanide poisoning affects cytochrome oxidase. Okay, so there is defect in oxygen utilization. Peripheral chemoreceptors are maximally stimulated and arteriovenous oxygen difference will decrease. Why? Because it is not taken by your tissues. Otherwise in vein it will decrease, in artery it will increase, but because it is not taken by the tissue, so in the vein also it is more. So the arterio oxygen difference will be minimum. Maximum is in the stagnant.